Hey guys, so I asked on my Facebook page what things you would like to see to get some help with pain management. And one of the biggest ones that I heard was hip tension. So this is a great one that you can do in a seated position. All of these movements you can do lying down, you can do in your car when you're driving, but they really are best if you can take a little bit of time and be still and really tap in to see what you're feeling. So here's the deal with somatics. Make sure that you don't have any underlying issues, just like with any other practice. You may, if you're concerned, you may want to check in with your doctor. And all of these, they're not meant as a prescription or in lieu of any medical care. So it's just to help with soft tissue and pain management and also stress management. The rules are keep it simple, stay gentle, make sure you're not moving into pain. And if there is anything that feels stressful as you go into these movements, you can always switch tacks, and instead of actually physically doing the movements, you can move into imagining that you're doing the movements. So here we go. Come on to the edge of your seat. And I'm going to be talking you through these rather than showing you because you know the drill. Hanna Somatics is meant to be experienced in the first person rather than watching me do the movements and try to mimic my movement. So you sit on the edge of your seat as tall as your body will allow. And the first thing that I want you to notice, those sitting bones, the bony part at the bottom of your hips, this is how you connect, right? So can you feel them evenly? Is one a little closer to the ceiling? Is one rolled forward a little more? How is your tailbone situated? So you just get familiar with that. The next place, so that's underneath what you're sitting on. The next place I want you to check in with are your hip bones, the bony part in the front of your pelvis. And that's what we're going to be using to gauge where we begin our movements today. So if you can tell that one hip is slightly forward and one is back, the one that's forward, that's the one you start with. And if you aren't sure, you're going to pick one. So here's the movement. The hip that feels like it's slightly forward or your first side, you just move that hip a little more forward. And I want you to pay attention to, where do you feel that? Is the movement, is the musculature that's creating that movement in the front of your hip? Is it in the back? Do you feel more happening in your opposite hip and your quad? Where is it? Slowly release that tension. Bring yourself back to your natural resting place. Now, you're not just moving at your hip, right? There's a whole kinetic pattern. So your leg is moving, but as your hip moves forward, what happens in your back? How does your upper body counterbalance this? And I want you to pay attention to all of these pieces. Do it again. Keep it gentle. Slide your first hip forward. What happens in your back, your hips? What do your shoulders do? Slowly release yourself as you come back to your natural sitting place. Pause. This is where you're allowing your nervous system to catch up with the changes that you've created, and you'll do the movement one more time. Send your hip forward and then slowly release as you come back. Now, let's stay on this side, your first side. Instead of moving your hip forward, you're going to hike your hip towards your armpit. So that kind of fleshy part around the bone on the outside, think about drawing that up towards your armpit. You might even notice that you naturally drop your shoulder. So shorten your waist on your first side. Slowly release the tension that this creates, and then let yourself rest. And you'll do that 2 more times. Draw your hip up, draw your armpit down. Slowly let that tension go and come back to your natural resting place. Pause. Go into this one more time. Hip and armpit move toward each other. Which one's doing the action a little bit more strongly? Notice that because it tells you how you normally use your body. Slowly release that tension and rest. Now, to finish off, if your feet aren't firmly touching the floor, if you're a shorty like me, and it's just the ball of your foot, you're going to press the ball of your foot down. If you've got something close by that you can press your feet flat into, do that. If it's the floor, great. So you push down, notice how do your hips respond? What does your back do? Slowly let that tension go. And now we move to your second side. So you're moving that hip forward and slowly release that tension. Pay attention to the muscles that create that action and go into it again. Slightly draw your hip forward, slowly release the tension and relax. Move into it one more time on your own. By now, it's beginning to get a little more familiar and you slowly let that tension go. So this time we're going to move to the second movement. Your hip comes closer towards your armpit drops down. You're essentially shortening the muscles through that side of your waist. Drawing your hip up, slide your armpit down, slowly release the tension, let yourself rest. Pause, and I'm going to give you some space here. Explore this twice more on your own. So begin to play with direction as you go into it. Maybe your hip comes slightly forward, slightly back. As you draw it up and you slowly release and you rest, take a breath in and out, and you'll go into that one more time. Create that tension, slowly let it go, and relax. Now when you finish, same thing. However your foot is connecting, ideally flat or just the ball of your foot pressed down, slowly let that tension go. And now check in. Your sitting bones at the bottom of your pelvis, when you started, are they the same? Did they shift? Are they balanced? What about your hip bones? Was one forward and one back? Is that still the case, or has that changed? When you start paying attention to these differences, this is when you get a little more information and feedback, and you can find the patterns in your body that you can begin to unwind. Let me know how it goes.